The plight of critically ill children in Gaza who've been unable to access life-saving treatment in the UK since the conflict began. ITV News has filmed with Palestinian babies and toddlers who will die unless they get urgent help. The UK government has previously promised to look at any applications to treat the children here. But charities and a leading paediatrician at Great Ormond Street Hospital say they felt stonewalled when they tried to apply. It's in stark contrast to countries like Italy and Qatar, which have brought over such cases for medical care. And a warning that there are upsetting images of young children in pain from the start of this report by our correspondent Rachel Younger.
Sadil was just a few weeks old when the war in Gaza began. Now doctors are measuring the time she has left in days. She needs an urgent liver transplant, and although her cirrhosis is something she was born with, it's Israel's siege of Gaza that's left her as close to death as some of the many children injured by the fighting. All doctors here can do is repeatedly drain her abdomen in one of the few hospitals left that's barely functioning.
Every day costs a life for a child when there is a delay, and Sadil is a really good example. She needs an urgent liver transplant now. Both her mother and father have tested positive as donors and are ready and able to do whatever it takes. But somebody needs to be ready to receive them.
Sumaya is the British founder of an organisation that's worked since the war began to get some of the sickest children to hospitals in the UK. She's assessed hundreds of cases and sent thousands of emails to the Egyptian and Israeli authorities that control the border, her frustration compounded by Israel's decision to close it in the past few weeks.
Every single day we hear of a child that has died because they just haven't been able to access that medical treatment that they needed in circumstances where anywhere else in the world they would have survived.
She shows me photos of Nabil, a previously healthy 4-year-old diagnosed with cancer. With chemo unavailable, she manages to find a route for him to get out of Gaza. But the day after he gets that news, Israel closed the border. He is somehow still dancing on his 5th birthday, but Nabil will not celebrate another. He died 4 days later, last Friday.
It's devastating as a children's doctor, someone who looks after the sickest children in the NHS, absolutely devastating.
But for this paediatrician, who also runs healthcare workers for Palestine, it's not only Israel frustrating his attempts to help. Because since the war began, we can find no evidence of the UK granting a single visa to a sick or injured Gazan child.
There will be some who will say, look, we've got nurses this morning saying the NHS is on its knees. It simply doesn't have the capacity to help. What would you say to that?
We've got essentially enough funds to cover a handful of children to come across for treatment. We made that very clear in our application to the Home Office. And despite that offer of actually covering the costs and all that would be needed as visas for these children and their families, again, no response from the government, completely stonewalled.
That's despite the Foreign Secretary indicating a willingness to engage months ago.
If that leads to the identification of specific cases where actually they would be better off taking that long journey back to Britain and going to Great Ormond Street or elsewhere, then we certainly don't rule that out and we'll continue to look at it.
Encouraged by that comment, we know of at least 2 charities that submitted visa applications to get children needing urgent treatment to the UK. This one, which has been shared with us, was delivered as an emergency application to the Home Office in early March. But on May the 13th, 2 months after it was submitted, a minister speaking on behalf of the Home Office told a parliamentary debate about Palestinian visas.
Particularly around this issue of admitting children to UK hospitals in order to be able to access treatment and support. What I can say about that is that presently we haven't received any specific applications.
The Home Office told us that applications are only judged as submitted when a child or parent travels to a visa application centre for passports and fingerprint checks. But in Gaza, that's long been a near impossible task. And yet, since the war began, ITV has travelled with injured children on evacuation flights not just to neighbouring countries like Egypt and Qatar, but further afield to Italy, one of a number of European countries to offer Gaza's children medical care in the last few months.
I find it very hard to believe that the Ministry of Migration and Home Office had not seen these applications come through, and it's very difficult to know why they would be acting this way, especially given, for me, the double standards of having been in a hospital that's treated, dozens of Ukrainian children. And that's the way it should be. That's actually a beautiful, fantastic response to a conflict.
And it's that spirit of generosity, something Britain prides itself on, that offers the hope children like Mustafa have left. At 7 days old, his young life, full of potential, was almost ended. His mother holds what she claims is the Israeli bullet that hit him in the head. He has seizures, she says. He's always in pain. The IDF told us it takes every feasible measure to mitigate harm to civilians, but with no MRIs operational here, there is no way to ease Mustafa's agony, nor Sadil's, nor the many children like them. Yet somehow they cling on, with doctors standing by in Britain ready to help, in the hope of a window in the fighting to get them out, and a door opening here to let them in. Rachel Younger, ITV News.